All right, it's time for us to do our Kegel exercises. Why do we do them? Who cares? Well, the reason is that our pelvic floors are very important for our health. Our pelvic floors hold up the organs of the pelvis, including in women, the uterus, the vagina, the bladder, and the rectum. And so the stronger you can make your pelvic floor muscles, the better you can support them.
I like it. So then we have this patented GynoCast customized Kegel exercise. World-renowned custom.
And acclaimed, prized-winning.
We sound super fancy when we talk about it like that.
That's right.
But you've come up with this great routine that we can use to help strengthen our pelvic floor.
So easy.
Right. So you ready to start it off?
I'm ready.
Okay. 3
times a day.
6
days a week.
9
seconds per Kegel exercise.
And 12.
Kegel exercise in a row for a rep. And so you're just doing it 3 times a day. Do 12. Hold it for 9 seconds. Okay, you can do it 6 days a week and take a day off. You'll have a pelvic floor like a chain link fence, Twila dang.
I like
You'll
it.
be able to pull a trailer. You will be the envy of your neighborhood. You will walk taller.
I'm going to go do them right now. I'd like to walk taller today. So make sure that you're doing them, and feel free to go get that infographic off of the GynoCast Facebook page and share it with your friends as well. Stay tuned.
Hello and welcome to the GynoCast. My name is Dr. Eric Heegaard, and I am a board-certified obstetrician gynecologist, and I'm here with
Twila dang.
Twila dang.
Hey, you let me introduce myself. That's amazing.
Yes. I want to empower you.
I feel good about it. Thank you.
So if you're a new listener to the GynoCast, welcome aboard, and we will talk just quickly what the GynoCast is. Mm-hmm. If you're a repeat listener, thank you. We love you as well, but differently than our new members.
We don't love everybody differently. Everybody's the same.
We love them as much, but differently. I love you more blue. I love you more red.
Oh, okay.
That sort of thing.
Sounds like a plan.
What is the GynoCast, Twila dang?
It is a podcast where we talk about anything and everything women's emotional and physical health and well-being.
That's right, and we do it well. We talk about things that perhaps most people want to know about, but maybe don't know where to do it. And so we do it here. Today, we are going to be talking about the transition from normal kind of reproductive time of life to menopause.
Oh.
What do you think of that?
I think I have questions.
I think you're there.
Thanks.
And you look good. But a lot of our practice has to do with this transition. And our guest today is Dr. Terry Johnson from OB/GYN West, the best OB/GYN group in the universe. Yeah. Would you agree with that?
I agree with that.
And Dr. Johnson is our senior member, and she has a specific interest in perimenopause and menopause. So thank you so much for joining us.
Thank you.
All right, so how am I doing, Twila?
So far, so good.
Twila has said,
yes.
I'm just going to open the kimono.
Okay.
That we got to move to our topic
faster.
You're
not. Okay, what did I tell you about telling people how the sausage gets made around here?
She says we're talking about other stuff.
No.
We start talking about
Oh,
Twila.
my gosh.
It's so fun. Okay,
and
let's
you're
go.
doing it again.
I know.
Okay. I love you, but I want to give the people what they came for.
Yes. Okay, so, Dr. Johnson, I know that you have a lot of patients that are in this time of life.
I do.
And I have some, but this is a big part of a gynecologist's practice.
Right.
And so can you tell us, because we kind of break it up into perimenopause, and some people call it premenopause, right? Is that?
Right.
And then the menopause with a big M, the menopause.
The menopause.
And so we're going to talk about these separately. Actually, there's going to be 2 podcasts. We're going to do perimenopause, then menopause. Mm-hmm. But what is perimenopause?
So first I would say, if we define both of them, perimenopause is the time before you go through menopause. Mm-hmm. Menopause means you've missed a year of periods.
So no bleeding for 1 year.
For 1 year. Then we'd say you're in menopause. Average age is 50 to 51. The range is 45 to 55. So perimenopause is somewhat defined as the 5 to 10 years before you miss that year of periods. The hard part is I always tell people at birth, your body knows when it's going to go through menopause. It just doesn't tell you that. So you will have no idea.
Oh.
But your body knows. Your ovaries know.
Your ovaries know. If women in their family, the women in their family go through menopause earlier, like in their mid-40s or later, closer to mid-50s, they will probably do the same thing, but average age is 50 to 51.
So there is some familial kind of tendency.
Yeah.
So if your mom went through menopause at 45, there's a chance you're more likely to go through menopause early.
Right. And we'll talk in the other podcast because how they went through menopause is a lot of times how you will go through menopause, good or bad.
Interesting. So, so as you said, the perimenopause is that time before you actually hit menopause. And I think before we actually started recording this, you were saying that basically when somebody comes into the office and they're in their 40s, they're there.
Right. So everyone, at least when I see them, everyone, once they hit 40, we talk about perimenopause and menopause. Part of the reason is women worry a little bit, when am I going through menopause? And they don't understand what that really means.
Mm-hmm.
So then we talk about, if you're 40, an average age is 50 for menopause, at some point in your 40s, you're going to have these perimenopausal symptoms because your ovaries are getting a little older. So hormone-wise, you have a little bit more fluctuation.
So what is actually, the main hormones that women make, estrogen and progesterone, what is happening to those as women are going through this transition?
Well, normally with a menstrual cycle, your hormones always fluctuate.
Mm-hmm.
Otherwise, if they didn't, you wouldn't have cycles. So your head always sends signals to your ovaries, gear up your hormones, and let's cycle and build up the lining of the uterus, ovulate, and then bleed.
Mm-hmm.
So during perimenopause, estrogen, progesterone will fluctuate. Usually it's progesterone that fluctuates first.
Okay.
So if you look at your cycle, when your estrogen and progesterone, when the progesterone is fluctuating, you sometimes it just can't peak like it needs to.
Mm-hmm.
So you'll either have, your cycle typically will be prolonged or just a little irregular.
Okay. So it's actually, kind of one of the ways I think about it, which I think is matching what you're saying, is that the well-oiled machine of your ovaries, that, the delicate balance, the ballet of hormones, right, Twila?
There's a lot of gesticulating going on.
I am waving my arms.
He's dancing.
Of the well-oiled ballet of your hormones, the estrogen, progesterone is not so well-oiled anymore.
Right.
They're like bumping into each other and running
right.
around.
And everybody's different because some people have minimum symptoms and go, okay, I'm starting to skip a lot of periods. Other people will find that when their cycles get a little irregular, they'll have some hot flashes, night sweats, irritable, heavier bleeding.
Okay. And so you were saying that progesterone tends to be the first thing to sort of change?
Right. I mean, estrogen, progesterone fluctuates. So what we talk about is when your progesterone starts to fluctuate, first, usually symptoms are you're starting to skip periods. You can't peak your progesterone high enough to tell your uterus it's built up the lining, it needs to bleed and get rid of it. Mm-hmm. So the hard part is when you first start skipping periods, and we don't know when you skip a period whether you're going to skip one period or 6 months in a row, but your estrogen hasn't fluctuated as much, so the estrogen keeps building up the lining of the uterus. So finally when your progesterone peaks, whether it's 2 months, 3 months later, you have to get rid of all of that buildup. So at first, you tend to have really heavy periods.
Okay. One of the things we talk about on the GynoCast that I think can be somewhat helpful for people is that you sort of think about the ovulatory cycle. The first half of the cycle after you get your period, you're developing the egg and your estrogen levels are going up. Mm-hmm. And then you release the egg. It explodes out into the fallopian tube. And then your ovaries start to produce progesterone. I
agree.
So the first part is kind of estrogen dominant. The second half is more progesterone dominant. And to have a regular period, you have to release the progesterone. And so when the progesterone, if you're not pregnant, the progesterone drops, and then you bleed.
Right.
And so what Dr. Johnson is saying is that in early perimenopause is that progesterone peak, which happens after ovulation, is not as good as it used to be.
Right.
And so we were talking about symptoms. The biggest thing I think you said is that people's cycles start to change.
Right.
So early, or they come closer together or farther apart? Is there?
Well, I mean, for occasionally what'll happen is some people will get 2 cycles in a month, just with hormonal changes. And if you do get 2 periods in a month, I'd say wait and see what your next cycle is, because usually hormone-wise you'll straighten yourself out and you'll ovulate a little better the next cycle. But if it persists, we want you to come in because you're not going to want to be bleeding twice a month. And we're looking to say, we assume it's hormonal, but we need to rule out, what is your thyroid doing? Do you have something in the uterus like an overgrowth of the lining called a polyp?
So what are some of the other, you talked about the cycle changes, hot flashes.
So other symptoms are, once you start skipping periods, usually your hormone levels are lower. They're fluctuating at a lower level. So you will get hot flashes, some night sweats. And as long as you can tolerate them and they don't alter your day, that's normal perimenopausal changes.
What do you think the biggest complaint of your patients that come to see you? What do you think the biggest complaint of that time of life is?
Well, I think before you start skipping periods, usually what will happen is, especially with women who have heavier periods, they notice before they start skipping periods that their periods are getting extremely heavy to the point that it alters their day. They're bleeding through clothes. They take extra clothes with them. So that's the first thing we usually hear about, is cycles are changing but getting heavier. Okay.
Twila, you look like you have something you want to say.
It just feels like this is all one big cruel joke of nature.
It is. It is.
It's like we're already the ones who get to do all of the heavy lifting in terms of reproduction. We do all of the heavy lifting.
It's totally true. Not all the heavy lifting.
Do you have stretch marks?
Yes.
Not from babies.
From donuts? Any donut-related stretch marks?
Sympathy stretch marks do not count. I mean, you already go through all of this, and then as sort of the process decides to wind down, it just decides to give you one good shove out of the reproductive
just to
years.
Remind you
it's not fair. It's just wrong.
Well, and Dr. Johnson, why does this happen? Why did the creator of the universe make this happen to us?
Oh, because women are stronger than men.
I agree with that wholeheartedly.
Well, it seems like the thing that I think about is that, 10,000 years ago, we'd all be dead.
Right.
We'd really be dead.
Yeah.
And we would have been 10,000 years dead. I mean,
right.
But what I mean is that we weren't supposed to live beyond 35.
Yeah.
Twila.
Yeah.
We'd all, be
I mean,
dead
it's a wondrous thing that I'm going to get to see a nice, ripe old age, because I'm working my way towards it.
Yeah.
But it is just such a funny quirk of nature that at every turn as something is about to change, it doesn't just sort of go quietly into the night. Right. It's just like, oh, you want to change this now? Hold on, let me make it more difficult for you for like 10 years.
Yeah.
So it's just always some sort of shift, and that shift comes with like a big sort of swirl to go with.
And it's not everybody that has all these symptoms. It's just when people come in, we talk about, if your cycles start getting really heavy, we need to hear from you. If you start skipping periods, that's normal in your 40s. And the longer you go between periods, that's when it'll trigger some hot flashes, some night sweats.
Okay, so is this the kind of thing where it's almost like equated to I'm most assuredly in the perimenopause years, but when I was in the pregnancy years and we were all having babies, there'd be one person like me that's miserable being pregnant, and then there'd be like my best girlfriend who's like, I'd be pregnant all day. I just had hiccups. That's it.
One person.
Where she just loved it and the experience was wonderful for her. Is sort of perimenopause and leading to menopause sort of similar in that fashion, sort of like even along that family line of, if it was hard on you guys, it'll probably be, the end of this will be as hard as the process in the middle?
I mean, not related to pregnancy, but there are some people that go through perimenopause easily and don't notice much. Others have a lot of symptoms, but a lot of it is based on, I usually ask them, how did the women in your family go through it? What did your mother go through? And they will somewhat mimic that.
I do have a sort of an ancillary question. Is there any sort of pain associated with sort of the going into perimenopause and menopause into menopause?
No, I mean, typically the pain is hot flashes, night sweats. You can also be a little bit more irritable before your period with hormone changes,
Okay.
but not typically pain.
But there wouldn't be necessarily like somebody that maybe never got cramps before all of a sudden starts cramping at their period, that kind of a thing.
Good question, Twila. You are
Hey,
really
listen,
throwing
I
in
told
some
you I
good
got
ones.
questions.
Well, yeah, no, that can happen because your ovaries, it's harder for them to ovulate, harder for you to have a cycle as you get closer to whatever age you're going to go through menopause. So some women will notice they feel ovulation pain and they've never felt that before. Or they'll have more cramping with their period, especially if their periods are getting heavier, because your uterus is trying to force more blood through a tiny area.
Oh.
Now, are there any particular health concerns related to this time of life? Meaning that I've heard that, for example, sometimes women may have changes in their cholesterol, the HDL, the good cholesterol, bad cholesterol stuff that can change as hormones change. Bone loss. I know this is probably more in
menopause we'll talk about.
But are there any particular things from a patient's standpoint that they should be advocating for themselves in terms of trying to be as healthy as they can? And are there any things in particular that a woman should say, I need to get in if this happens?
So I think the healthiest thing women can do going through that is trying to maintain their weight, because as you get closer to menopause, women will come in and say, well, the perimenopause or menopause is related to my thyroid not working, and it's hard to, I keep gaining weight, it's hard to lose weight. And it's really not menopause or perimenopause per se that's doing that, is you are getting older. Your thyroid does slow down a little bit, usually not enough we can pick it up, it's subtle, and you aren't as active. So the biggest thing is if you can even maintain a weight, that's hard to do. And losing is even harder, but that has more of an effect on, cholesterol.
Mm-hmm. So do you, one of the complaints a lot of my patients come in, I think I've talked about this a number of times with my patients this week, is women will complain about the weight distribution changing, like more around the waist.
Right.
Is it understood why that happens?
Well, I think part of it is estrogen gives elasticity to your skin and tissues. So if you look at women that do go through menopause, like at 45 versus someone that goes through menopause at 55, they have more wrinkles. I mean, genetics also plays a part of it, but you wrinkle a little faster and you lose the elasticity, so things just with gravity fall.
God, it sucks.
I know, right?
It really does.
But that's okay.
Well, so I was going to ask you, Dr. Johnson, about bleeding. Like you're talking about women will skip periods, or there'll be an increased interval or a decreased interval. When should a woman be concerned that it's something that she needs to get evaluated? I know one of the answers would just be symptomatic. It's just bugging her. But is there, like, in terms of possible uterine cancer or something like that?
So if you're bleeding to the point that I tell people, if you're soaking a pad an hour, or it's altering your lifestyle, you're bleeding through clothes, you worry at night when you go to bed. So if you have really heavy periods, and for us, we would say like soaking a heavy pad an hour. Clots for us, little tiny clots, dime size, don't really concern us. I always tell people, if you have a clot the size of a golf ball, that is worrisome. So if your periods are getting heavier, they alter your day, or you get a period and it may be manageable, but you spot and bleed on and off till the next period, then we want to see you.
Yeah, so irregular, sort of unpredictable bleeding.
Yeah.
Okay. One of the big, the other things that some of my patients complain of, which is always hard to know what to do, is changes in libido.
Right.
Oh yeah, we used to get that question a lot when we did the other show. That was a very common question for us.
Well, what I tell women, part of it is I always say we are more complex than men. So
nuanced.
Right.
Both.
So for men, sex drive, their testosterone levels are so much higher than ours normally are. So a lot of sex is driven by testosterone. So I tell people you could have had the worst day, had the worst fight, and afterwards they're like, well, what do you mean we're not going to have sex?
Right.
So that's more hormone driven. For women, testosterone is a part of it. Our testosterone levels are not high. So when our ovaries start to slow down, we are losing part of testosterone, but there's more of an emotional part also. It's like if you have kids running around or you're exhausted at night, you have to be in the right mood. So testosterone plays a part, but there's a lot of other things that come into play.
So
Okay, I have a question about that. I have a lot of friends sort of in a swing of age range from like 30s to like late 50s. And a lot of my older friends who are older than me, when we started saying, I think, perimenopause is coming, I'm getting hot flashes, getting a little weird around here. They almost all universally said, oh, hey, a lot of stuff is going to go wrong, but enjoy the libido because you get a weird surge and it's a lot of fun. And I've heard that quite often from a lot of my women friends that are in their 45 plus or who are like now solidly in menopause. Like they had sort of a sweet spot where they were just like, everything's great. Don't ask me why, but I'm going to enjoy it.
Yeah, and I don't know why, unless it's a time of life for them also, is that they, kids are gone, elderly parents are doing well, and they're in a great relationship. There are a lot of relationships that as you get older don't do as well. So I think part of that is what is their relationship like with their significant
So
other.
you might have a great relationship and the house is quiet.
Yeah.
And the dog is
and you're rested. and you've rested. Yeah.
Fair point.
I'm sorry. Isn't that where, I'm going to tell the old joke. I'm not going to go, Twila?
Yeah.
I'm not going to
see
do the
me
whole
looking at you.
The old joke about when does life begin? And one of the, they are arguing back and forth. And, one person says, well, in our religion, we believe that life begins when the dog dies and the kids leave for college.
That's terrible.
Is
I'm
it?
going to repeat it several times today, but it's terrible.
Support for the GynoCast is provided by OBGYN West. OBGYN West provides the highest quality care from compassionate providers, including women's health issues from general sexual health to pregnancy care, childbirth, menopause, and beyond. Whether it's your teen's first annual exam, a new baby's on the way, or you're facing the special challenges of middle age, OBGYN West provides a wide array of services. Their doctors and PAs are trained in virtually every type of OBGYN service and procedure. OBGYN West provides exceptional care for women.
Well, so what do you think about, okay, so let's talk about treatment. So not everybody needs to be treated, but some if the symptoms are bad enough.
Well, and I think the other thing we should talk about a little bit is if you talk about treatment and symptoms, women who still have their uterus, it's easy to figure out what's going on because we really look at it based on what is your bleeding pattern. I always tell people perimenopause, menopause, medicine should be black and white. And this is the gray area. Everybody's different. Their hormones will fluctuate. So if you say, if you have a uterus, we know what your bleeding is.
Right.
We don't need to check blood levels because if we say estrogen, progesterone, if you're having regular periods, your hormones have to be in the normal range for you to cycle. So if they're a little erratic, I'd say we know they're fluctuating. Yeah. And I'd say I don't want to waste your money on hormone levels.
So there's no particular test that will tell you you're in the perimenopause.
Right. I mean, it's a little harder if you've had your uterus out or you've had an ablation and you don't have any cycles.
An ablation is when you burn the lining.
When you burn the lining, yeah.
To decrease bleeding.
So when you don't have cycles, then there are times we'd say, well, let's try and chart it and see what your month is like. There are times where women come in and they may say, okay, for 6 months, awful hot flashes and night sweats. And my assumption would be is if they still had their uterus, they may have missed, 5 to 6 months of periods. Mm-hmm. And if they come in and say awful symptoms, hot flashes, night sweats, but then they look at me and go, my symptoms went away, I don't understand that. That would make me think if you had a uterus, you were gearing up for a period because your hormones were increasing, your symptoms will go away. Mm-hmm. So then there are times I would do some blood levels based on what their symptoms are if we don't know what their bleeding pattern is because their uterus is gone.
That makes sense to me.
So when we're treating, when we decide to intervene, it's usually because we're trying to manage what are the symptoms of perimenopause. Right. So either abnormal bleeding or hot flashes or something like that.
Right.
Can you talk about or mood swings?
Yeah.
Can you talk about some of the the options we use to manage those?
Well, so if you said either hot flashes, night sweats, bleeding, or mood swings, if you said, they're there, they're minimum, they don't alter my day, I can function, we typically don't treat them.
Mm-hmm.
If somebody comes in and there are a lot of women on birth control pills in their 40s. The nice thing about birth control pills is it gives them a steady state of hormone. So even though they're having internal fluctuation of their hormones, they don't notice it as much. So as they get closer to menopause, minimum hot flashes, regulated cycles, and if they have friends not on pills, they'll notice all these symptoms and they'll be the ones kind of smiling going, I feel great. So if women are on birth control pills for birth control or cycle control, if after age 40 their blood pressure is normal, they don't smoke, they don't have migraine headaches, they can stay on birth control pills until menopause.
Oh.
And they're not going to know when they go through menopause. So about age 49, that's when we check a hormone level. So once they're in menopause, we take them off.
So do you stop the pill for a while and then check the hormone levels?
So usually what I would do is, most women start a new pack of pills on Sunday.
Mm-hmm.
Mm-hmm.
And we would say, don't start your new pack of pills Wednesday or Thursday. Come in for your blood level. And then if you came in Wednesday, draw your blood and then double up on your pills to catch up again. And it won't alter anything. And we get blood level results back within 24 hours.
And what are you checking?
So we're checking the FSH, the signal your head sends to your ovaries to work.
Okay, so yeah, for people who don't know, FSH, follicle stimulating hormone, is the hormone that your brain, the signal that your brain sends to the ovaries to make a follicle, which is where the egg grows.
Right.
And so as women get older and the eggs or the ovaries are kind of pooping out, the brain has to send more
signal, so the level is higher.
So it's like Twila, when you were 25,
Yes.
your brain would say to your ovary, go ahead and make an egg. Shh, go ahead and make an egg. Now when you're 50, it's like, make an egg! It's screaming out FSH. So the FSH is huge.
And your ovaries aren't responding.
Make an egg!
I got it.
Yeah,
Right.
It's like your ovaries are deaf.
Right. So women on birth control pills tend to do very well in the perimenopause. So if you're not on birth control pills, we would address which symptom you have. So heavier bleeding, we can regulate that. We'd first say, we assume it's hormones, but we'd say, what is your thyroid doing? Because a sluggish thyroid will make your periods heavier. And we'd also say, do you have something in the uterus, like an overgrowth of the lining called a polyp, making your cycles heavier? So usually we'll have you come in and we'll check your thyroid. We'll look with an ultrasound just to know that uterus and ovaries are normal. Then we have to regulate cycles, heavy bleeding. One of the things that work in at least half of women is ibuprofen. So
really?
higher doses of ibuprofen, which, like most women in general, if they say, well, what's your heaviest day of bleeding? A lot of women will say day 2.
Mm-hmm.
So we'd say
Day 1 being the first day of your period.
Day 1 being the first day of your period.
Right.
So they'd say, my second day of my period is heavier. So then the first day of your period, we'd say, okay, we'd want you to take ibuprofen the first and second day of your period. 4 tablets every 6 hours. First day of your period, second day of your period. And in half of women, their bleeding is lighter because it kind of blocks one of the hormones that increases bleeding called prostaglandin. So that's easy. It's the first thing we do.
And it's cheap.
Yeah, it's really
So-
cheap.
Well, I mean, that's like over the counter. You can.
Yeah.
So I just want to clarify. So Dr. Johnson's saying ibuprofen, which is also Advil.
Or
Or
Motrin.
Motrin.
Yes.
Over-the-counter pills are 200 milligrams.
Right.
So you're saying take 4, which
Right.
is 800 every 8 hours. How often would they take that?
So every 6 hours?
Every 6 hours.
So 4 times a day, just for 2 days, maybe 3 days at the most. We don't want you on high doses of ibuprofen daily for long periods of time. The other one that works is Aleve. So for some women, Aleve is every 12 hours, so it's easier for them to remember.
And that's naproxen, right?
That's
Or
naproxen.
naproxen.
Yeah.
Okay.
So it's 1 every 12, and we tell people prescription dose would be 2 every 12. So we want you at 2 every 12.
And so just a little public service announcement. This is a great option for women, make sure you check with your doctor before you take these medications.
Right.
Because some people
have other medications that
well,
could interfere.
All of this is information where you should be gathering information from us, but you should be checking back in with your primary provider, your healthcare provider, and asking that specific question, especially in regards to your own health. What kind of other health situations you have going on. Absolutely, because drugs can interact with other drugs. So you make sure, don't just sort of take this and go, hey, I listened to the GynoCast and now I know what to do for my perimenopause. No, you have an idea. Now you need to take it to your doctor and come up with a plan.
Right. And when we're seeing someone, we're seeing their medical history. So we know, can you take an ibuprofen or not?
Mm-hmm.
So yeah, I agree with that. You need to take that to your doctor as a plan.
Absolutely.
So just to kind of recap, you said management of cycles that are symptomatic and problematic. Birth control pills can be helpful. Again,
ibuprofen,
Advil, Motrin, naproxen.
Yeah. And some
are the kind of beginning ones.
Right. I mean, the other ones that I talk to people about only because we don't use them very often because of the side effects, is I tell people, well, I can give you doses of progesterone, high doses, injections, and you won't have periods anymore. But if you're over 35, you will gain weight and get depressed. So we don't use that.
Yeah, that's
but I mention it.
Gaining weight and getting depressed
right.
after 35. You don't have to be a woman to.
Well, and I mention it only because a lot of people will do a lot of research and come back and go, well, why didn't you talk about this? So I always tell you there's an injection of progesterone we're not going to use. I could give you an injection of something called Lupron to put you in menopause, but then you're really going to be irritable, hot flashes, night sweats, and we wouldn't do that. One of the most common things we use to control cycles is the progesterone IUD called Mirena. It's progesterone that's in the IUD. It sits in the uterus, and it blocks the reaction. So your hormones are telling the uterus, build up the lining, and it can't because of the progesterone in the IUD. So then over time, you will either have no periods or significantly lighter periods. And that's probably the easiest. It's done in the office.
There's not a lot of systemic progesterone
right,
that gets in the blood.
Right. I tell people it really doesn't bump up your blood levels. It's directly acting at the uterus.
So I think the take-home message regarding cycle control is that don't suffer. And if it's one thing if you're not really having problems, but if you do, there's a lot of options that are safe and can be helpful for managing that.
Right.
And let's talk a little bit about the hot flashes again. How do you generally manage those?
Well, so some of the things we can do is we'd say, well, if the progesterone is the first to fluctuate, there are over-the-counter progesterone creams that you can get at GNC, Lakewinds. The thing with the progesterone over-the-counter creams is you don't absorb very much of it. So you could lather up in the whole jar or tube and you'd never overdose. But you're still making progesterone because you're still having cycles.
Right.
So sometimes it just supplements minimally. And for some people, hot flashes, night sweats, irritability will go away on just over-the-counter progesterone. And I do tell people, if you're in menopause not making any hormones, progesterone cream isn't going to do anything because you don't absorb enough of it to help. But when you still are making some hormones, sometimes just adding a minimum amount is all that the cream is may help. So you could try, especially if you said, I don't want to do anything prescription, I'd say, well, you can try over-the-counter progesterone cream.
Okay.
My little thing with that is I tell people there's all different brands, all different price points. The cheapest doesn't have to have any progesterone in it because it's not regulated. So don't buy that. The most expensive has progesterone, but you're not absorbing much of it, so you're kind of wasting your money. So just middle of the road, ask them wherever you're getting it. They'll tell you which is the popular one. So progesterone over the counter for a few women will help. Otherwise, we talk about, do we supplement with prescription progesterone? Mm-hmm. Or do we add a little bit of estrogen? So it kind of depends on the symptoms. If a woman has heavier periods and we add estrogen, we're going to make their periods heavier. Mm-hmm. So we kind of say, well, then maybe we do progesterone versus estrogen. So it's not It's based on symptoms, but it's also based on the patient and what their symptoms are, which one we're going to use.
So, again, kind of, I'm trying to encapsulate this a little bit. I get the sense from you, and this is my own experience too, is that this is part of that area in medicine where there's art and there's science.
Right, and this is the art.
This is kind of art where you try things.
Yeah.
And you kind of manage it that way. One of I think the public service announcements that we can do on this show is there are clinics that will charge you immense amount of money to check a lot of labs.
And they'll fluctuate. So they're kind of, in my feeling, a lot of them are worthless unless you don't have a uterus and we can't tell what your bleeding is. But the labs don't help us at all. It's normal. We always hear that we should
be checking estrogen levels or progesterone levels or testosterone
right,
levels.
and we should balance our hormones. Our hormones have never been balanced. They have to fluctuate to have cycles. So the norm is fluctuation.
Yeah.
And once you get to menopause, that's when they're balanced because they're low and not fluctuating.
Yeah.
So Mother Nature, the norm would be not to treat it, not to regulate it unless it's altering your day.
And again, I just this is one thing that sort of drives me crazy. And I think we've all,
and me too,
because there are clinics out there that I think are kind of opportunistic, and this is a population that are vulnerable. They're saying this is a time of life when people are not happy,
right?
And they will charge thousands of dollars.
Oh, people spend thousands
for labs.
Wow!
And I can tell you what your labs are going to be based on what your cycles are doing. So I don't need to waste your money.
And basically, oftentimes we're kind of managing via their symptoms anyway,
right? We're managing their symptoms, not what their blood level tells us.
Right. How about testosterone? A lot of people have questions about testosterone supplementation. So you were talking about libido. This is something that really frustrates a lot of people, and some people will try testosterone supplementation during this time.
Right. Well, and I think there's a lot of talk about it. So the norm is it decreases, libido is less. There is a huge discrepancy between partners because I tell people that doesn't decrease till they're in their later 60s. So there's a huge discrepancy.
Why did the creator of the universe, whoever she is, do that, Dr. Johnson?
Yeah, I don't know.
Why do men keep... Twila, you should have an
insight I don't have an answer to this because I always tell you I don't fall under the typical female category anywhere. I'm basically a dude over here.
Seriously, why is it that an 80-year-old guy still would be making sperm, and yet a female stops making eggs at 50?
Haven't a clue. I have a lot of questions when I get there.
Well, that gives me a good segue just briefly into the GynoCast Facebook group. So if you're not a member of the GynoCast Facebook group, please join because I want an answer to this question. So you can go to Facebook, search the GynoCast. You can ask to be a member of this exclusive group, and then you can put your input. Why is it that women stop producing eggs at 50 and men are still producing sperm at 105?
Right.
We all want to know. Twila wants to know, Dr. Johnson wants to know, and I want to know.
At this point, I don't know if I want to know. I'm good. I'm just good to know that I'm not going to slip up and have any more surprises around here. I'm good on that.
Okay. So we've talked about hormonal management for hot flashes, and you talked a little bit about over-the-counter progesterone. But there's some other things out there. Have you had any experience with like Estroven? I've had people using that. That's an over-the-counter. Black cohosh, that sort of thing. What do you think of that stuff?
If you look at research on these, they have been studied. And in studies, they haven't been shown to have an effect. But there's also a placebo effect.
Right.
So for some people, knowing they're on something, they feel better. And I tell people if you take like Estroven as directed, over-the-counter things as directed, typically they're not harmful. They're harmful when people would say they're over-the-counter, therefore instead of one tablet, I'm going to take 3 or 4.
Mm-hmm.
Right.
That's where they're harmful. And if it works, fine. Like Black cohosh interferes with some of the antidepressants people are on.
Mm-hmm. Okay, so Black cohosh is like an alternative?
It's,
okay.
Yeah.
Yeah.
It's
okay,
like
so
a tablet you take.
Okay,
over
so
the counter.
this is kind of like the echinacea group of, like,
Yeah,
oh,
it's
take
herbal
this to
For St.
complement.
John's
some
wort,
sort of herbal.
Herbal.
And you made a really good point about the fact that they're not regulated. That is
Right.
something that we can't sort of communicate that enough. A lot of those type of over-the-counter, quote unquote, really loose air quotes, medications or vitamins or supplements are not regulated at all. So I think it was a few years ago that we saw that study that came out that showed that a lot of these products, when they actually broke the tablets open and studied the tablets, they were maybe less than 10% of what they said it was going to be.
Or none at
Right.
all.
Yeah,
Well, they have
Sawdust.
it's 15% they have to be accurate. So if you're buying a product and it says 15% of something, it can have 0 in there, and that's okay.
Yeah.
So you just don't know what's in it.
Right. So when you say placebo effect, it's just the idea that I'm doing something to be proactive so I feel better about it.
Right. And that does happen. So it is a known entity that can make people feel better.
Well, is there, given that we know that certain medications work depending on sort of where you are, and that we are trying to, I don't think it's overstating it to say that we all recommend that you not do these over-the-counter supplements necessarily?
I think, well, Dr. Johnson, I'm going to let you take the...
This would be my own personal feeling. If somebody's telling you to take all of these supplements and they're selling them, I assume they're making a lot of money on that.
Okay.
But that's just my assumption. And I would say you really have to look at it. And, if you look at all of the companies out there, even for medications, yes, they're there to help you, but they're really there to make money.
Yeah, all businesses are... all businesses are profit driven.
Right.
So there's
Right.
and if you know that going in up front, it kind of makes it a little bit easier to keep some perspective.
Right.
Now, is there a link between, say, nutrition and some of these symptoms, or is there anything that you can do with what you take into your body in terms of how you fuel yourself that would help?
How about blocks of tofu?
Yeah, I don't know.
I eat blocks of tofu no matter what.
I know. I think everyone's so different. You can't say, well, eat this or eat that. We're supposed to increase soy is supposed to help with hormones because it'll act like an estrogen.
Don't they call those phytoestrogens?
Phytoestrogens, yeah. But then you have to worry about the person just going and taking those because if you have a risk of breast cancer, depending on family history, genetic makeup, those may not be good for you.
Yeah, and if you have sensitivities to it, I know some folks that they got older and they tried to increase their soy intake, and the husband decided to do it with the wife, and turns out he had a sensitivity. So it was like, you have to kind of always be careful of that stuff too. Even when you're, as with anything, before you start any sort of significant change, you should consult your health practitioner first.
Right.
I always and I tell people too, is just that if it has an effect, a lot of these complementary alternative medicines can have an effect.
Right. Because there's Eastern medicine. We don't know a lot about it. So there are things that work. We just don't know as much about it.
Exactly. But my concern, the thing I just try to talk to people about is that I think if it has an effect, you also have to assume there may be just like anything. Too much water can be dangerous.
Right.
So if you're taking, just because something's natural or complementary doesn't necessarily mean it's safe. And you have to assume that there are risks even with these over-the-counter alternative medications.
Right.
That's what I'm saying.
I think that's a fair point. I think that's...
And tornadoes are natural.
Snake venom's natural.
Yeah, that's right.
That's my thing.
All
I think
things
about.
I'm going to avoid today.
Twila, do you know that the duck-billed platypus is venomous?
Yes, I did know that.
Do you know that, Dr. Johnson? It's the only venomous mammal.
We've watched a lot of Phineas and Ferb in our lifetime,
and
that
is.
It's a cartoon, and one of the centerpieces of the cartoon is a platypus. And so when your kids get obsessed with it, they start looking things like that up.
Yeah,
so.
I think it's the only mammal that is venomous and lays eggs. I think.
Oh, well, there you go.
There you go. So if you're on the Facebook group, you can comment on that. So
Libido.
Libido. Yeah, go for it. Thank you.
Well, so I would say there is testosterone cream you can use. Men have testosterone products. They have patches. They have sprays. They're too strong for women. So if you would take their dose, you're going to get facial hair, acne, and it'll increase your weight. So we do have some creams that are a lot lower dose. And if you're still having regular periods, my assumption is your testosterone is normal. So if we're going to try those creams, we would first check your level.
Okay, so that would be a situation where you would actually be checking
Right.
testosterone.
If you had missed, say you're 50 and you've missed 8 months of periods, I know your testosterone's on the lower end, so I'm okay trying it. And then I would tell somebody is if we're trying it for a month and you don't have increased sex drive, you don't have the effects we're looking for, then come in and let's check your level. More to verify it's still low and we can increase the dose that we're using.
Okay, so we use that stuff.
And there is an FDA-approved product to increase sex drive.
I will give
For
you
women?
I will give you. I'm just tell you. I'll give you a $15 Starbucks card if you can say it correctly.
I can't.
It's something like Flabanos.
But do you realize what the side effects are?
Well, I also know that it's like it increases like one sexual event every 3 months.
Right.
It's like,
it is a type of antidepressant.
Yeah.
It got denied by the FDA numerous times, and I think it got approved just because of peer pressure.
Yeah.
And the one thing it does is it drops we can only use it in women in perimenopause, not menopause.
Mm-hmm.
It drops your blood pressure if you're laying, so you do have a risk when you sit up after sex of passing out.
so you're not going to pass out during sex.
Not during sex, unless you're standing up.
If you sit up.
Yeah, if you sit up. So people do pass out from it.
How do they know it's not just because their partner's just fabulous?
Because they know if their partner was
It's
that fabulous
mind-blowing.
before, they would be passing out before.
Right,
wow,
right,
she's
right.
passing out on me right now. Wow.
This feels like it's like the drug they give it to you, and they're like, okay,
Well,
but take
and
it on a Tuesday at 4:00, stand counterclockwise. It's like that seems
I think it's
ridiculous.
dumb.
It acts like an antidepressant, so it just makes you feel better that you're not having sex as often as you want.
Wow.
So it's really not a
Okay,
good
so,
product.
Yeah, that's exact, and nobody can say the name.
No, but nobody prescribes it because you have to have a special.
Oh, you have to be.
You have to be certified and take a course in order to prescribe it, but it doesn't have any good side effects.
Wait a minute. You guys are doctors. I mean, nobody gets more training than you except like astronauts. And so you spend all of these years, you become an expert at what you do. You've practiced this forever, and then there's a drug that you can't even prescribe that
Or
is
pronounce, for
wonky.
that matter.
That is wonky at
It's like
best.
Flabanos syrup.
And
Right.
you get to take an additional class to be able to say that you really don't want to give this drug out on a regular basis.
Right. So nobody does because of the side effects.
It
This is
well,
a
you-
It
home
doesn't
run.
work.
It doesn't work. You have to have extra training. It's
This
just
drug
you pass
sounds like
out.
a home run.
Yeah.
It'd be better just to spend the extra money for a nice dinner, candles, some music.
Vacation.
At this
Vacation.
point, it'd be better to spend your money on some like recreational weed if you live in a state where it's legal and just keep on going.
Twila, dang. This is a family program.
I know it's legal in several states, including ours. Well, for in a
Medical.
minimal capacity.
Okay, so I wanted to ask, speaking of antidepressants, that there are some other options in terms of managing hot flashes, too, that aren't hormonal.
Right. And
like some
also
of the-
for women who have a lot of irritability the week before their period. And that's one of the symptoms of perimenopause. And for some women, we'd say, well, if symptoms of like PMS, irritability are to the point they alter your day, we can give you a medication. I always tell people years ago, it used to be pink and purple for women called Serafem.
Oh, yeah, right.
And
Oh,
really
wow.
what it is Prozac
Yeah, it's just
colored
generic.
pink and purple with a different name.
And more
So
expensive.
that
Stop it.
yes,
Yeah.
but that way women
just
wouldn't feel
Prozac.
bad taking Prozac. Well, Prozac, the generic is fluoxetine, and for PMS you only take it that week, and you're at normal for depression, standard doses are 40 to 60 milligrams of fluoxetine or Prozac. For PMS, we use 10 or 20. So it's a low dose, and it's only used the week before your period. And it just evens out how you're reacting to your hormone changes.
Yeah, I've had
It works
great
really well.
results with that.
And I always tell people, some people go, okay, antidepressant, don't want to try it. And I'd say, do a study. You know how you felt. Try it, because you're only going to be on it 5 to 7 days, and see what you think. It doesn't commit you to taking it.
Exactly.
Yeah.
That's a great point. Is that I think people think that they have to commit to something for a year. You can try things for a
Right,
short time,
right.
see if it gives you relief, and then you can weigh the risks and benefits of whatever you're trying based on
Right.
But I think
you're
that
feeling.
turns into that thing where when you combine things like this with the insurance industry at large, if you're going to commit to something, all of a sudden you do kind of go in your head and go, okay, am I going to be committing to this, and how often am I going to? You do kind of get in your head over it, and especially with medication, because it always does feel like an all in, especially when it's something that isn't as cut and dry as you have an infection, you take this, and then the infection goes away. This doesn't necessarily go away in the immediate. So in our head, we do kind of panic and go, wait, you're putting me on this? Wait, so it really is, this is serious. This is more. This is like you, and especially anything that has to do with mental health in general.
Right.
You will just immediately spin out and start to panic and think, I got it. I don't need that. I don't want to be seen as not able to manage myself or my emotions. Yeah. So it does. I can see how people would sort of panic and not give themselves permission to even in a small scale say, try something for 5 days and see what it does for you.
It's an interesting point, actually.
Yeah, and we do low doses, so I really try and stress it's a low dose. It would not treat you if you had big-time anxiety or depression. It's just, we're saying, let your hormones fluctuate, but let's alter how you react to them just during that time.
And also we use antidepressants or SSRIs for management of hot flashes, too, in some people. And do you ever I think I've heard you talk about this in clinic, like gabapentin.
Yeah, well, and it's more for menopause, but we do use it, but we talk about it more with menopause.
Okay.
Well, we're going to have to list a lot of these things. We've listed a lot of medications or potential medication. It'll be in the syllabus. We'll figure it out.
Okay, well, Dr. Johnson, thank you so much for joining us today. Appreciate it.
Thank you.
You've been listening to the GynoCast. Join the Facebook group, right, Twila?
It's super easy to do. It is, and it's a lot of fun to be there. I just go to Facebook, type in the GynoCast. You do have to request to become a member. It is a private group, but we do that just to make sure that the conversations and the information that we share on there is treated at the level we want, which is at a respectful level. These are sometimes difficult conversations, sometimes questions that people are not always comfortable asking in public spaces, and we want to provide a safe space for that to happen. So we do that there.
All right.
Thank you so much for listening.
Thank you.
We'll talk to you soon.